Today, we're talking about Nefazodone Hcl, a medication used to treat depression. Due to the potential risk of liver disease, it's typically reserved for use after other medications have been tried. Nefazodone works by helping to restore the balance of certain natural chemicals in the brain, such as serotonin and norepinephrine. It's important to follow your doctor's instructions carefully when taking this medication. The daily dosage and the optimal timing of taking this medication can vary depending on the individual and their specific needs, so make sure to discuss this with your healthcare provider. Before taking Nefazodone Hcl, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually twice daily. The dosage is based on your medical condition and response to treatment. Your doctor may start you at a low dose and gradually increase it to reduce the risk of side effects. Take this medication exactly as prescribed and at the same times each day. Keep taking it even if you feel well, and do not stop taking it without consulting your doctor. It may take several weeks before this drug takes effect, so make sure to inform your doctor if your condition lasts or gets worse. Some common side effects of Nefazodone Hcl may include dizziness, drowsiness, lightheadedness, nausea, dry mouth, or constipation. To reduce dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. If you experience dry mouth, you can suck on sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. It's important to remember that your doctor has prescribed this medication because they have judged that the benefits to you outweigh the risks of potential side effects. However, if you experience any serious side effects such as confusion, weakness, fainting, seizures, easy bleeding/bruising, black stools, vomiting that looks like coffee grounds, eye pain/swelling/redness, widened pupils, vision changes, or a painful or prolonged erection lasting 4 or more hours, you should seek medical help right away. While rare, a serious allergic reaction to this drug could occur. If you notice any symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects not listed here, make sure to contact your doctor or pharmacist. Remember to always consult with your healthcare provider if you have any concerns about taking this medication. Antidepressant medications like Nefazodone Hcl are used to treat conditions like depression and other mental/mood disorders. They can also help prevent suicidal thoughts and provide other important benefits. However, it's important to be aware that some people, especially those younger than 25, may experience worsening depression, other mental/mood symptoms, or suicidal thoughts when taking antidepressants. It's crucial to talk to your doctor about the risks and benefits of taking antidepressant medication, especially if you're younger than 25, even if it's not for a mental/mood condition. If you notice any worsening depression, unusual behavior changes, or other mental/mood changes, such as new or worsening anxiety, panic attacks, trouble sleeping, irritability, or severe restlessness, it's important to tell your doctor right away. Nefazodone Hcl has the potential to cause very serious liver disease, so it's important to be aware of symptoms such as nausea, vomiting, severe stomach pain, unusual tiredness, loss of appetite, dark urine, or yellowing of the eyes and skin. Before using this medication, make sure to tell your doctor if you have liver disease or abnormal liver function tests. Your doctor should regularly perform liver function tests while you are taking this medication. If you develop liver problems or abnormal liver function tests, your doctor may direct you to stop taking this medication, and you should not take it again without consulting your doctor or pharmacist for further guidance. Before taking Nefazodone Hcl, it's important to let your doctor know if you have any allergies to this medication or similar ones. This medication may also contain inactive ingredients that can cause allergic reactions or other issues, so it's best to talk to your pharmacist for more details. It's also important to inform your doctor about your medical history, especially if you have a history of liver disease, psychiatric disorders, suicide attempts, heart or blood vessel disease, seizures, intestinal ulcers, glaucoma, or if you are planning to have surgery. Nefazodone Hcl may cause dizziness or drowsiness, and using alcohol or marijuana can increase these effects. It's important to avoid driving or using machinery until you know how this medication affects you. It's also best to avoid alcoholic beverages while taking this medication, as alcohol may also cause liver disease. Older adults may be more sensitive to the side effects of this medication, especially dizziness, drowsiness, or bleeding. If you are pregnant, it's important to discuss the risks and benefits of taking this medication with your doctor. Similarly, if you are planning to become pregnant or think you may be pregnant, it's important to discuss the use of this medication with your doctor. It's also important to consult your doctor before breastfeeding, as it is unknown if this drug passes into breast milk. It's important to be aware of potential drug interactions with Nefazodone Hcl. Make sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Certain medications, such as carbamazepine, fluoxetine, and medications for high blood pressure, may interact with Nefazodone Hcl. It's important to discuss all medications you are taking with your healthcare provider. Avoid taking MAO inhibitors with this medication, as it can cause a serious and possibly fatal drug interaction. Also, be cautious about taking elatriptan within 72 hours of taking Nefazodone Hcl. Additionally, Nefazodone Hcl can slow down the removal of other medications from your body, affecting how they work. This can include opioid pain relievers, muscle relaxants, and certain benzodiazepines. Be sure to inform your doctor or pharmacist of any other products that cause drowsiness, such as alcohol, marijuana, or drugs for sleep or anxiety. It's also important to check the labels on all your medicines, including over-the-counter products, as they may contain ingredients that cause drowsiness. This is particularly relevant for products containing pain relievers/fever reducers, as they may increase your risk for bleeding if taken alongside Nefazodone Hcl. If you are taking low-dose aspirin for medical reasons, consult your doctor or pharmacist for more details. If someone takes too much Nefazodone Hcl and experiences severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, and extreme drowsiness. It's crucial to seek immediate medical attention in case of an overdose. It is important not to share this medication with others. Your doctor may also require you to undergo lab and/or medical tests, such as liver function tests, while you are taking this medication. It is important to keep all medical and lab appointments and consult your doctor for more details. If you happen to miss a dose of Nefazodone Hcl, take it as soon as you remember. However, if it's almost time for your next dose, then just skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. It's important to stick to your regular dosing schedule to get the full benefits of this medication. It's important to store Nefazodone Hcl at room temperature, away from light and moisture, and not in the bathroom. It's also crucial to keep this medication out of reach of children and pets. When it expires or is no longer needed, it must be properly discarded. You can consult your pharmacist or local waste disposal company for guidance on how to do so. Remember not to flush this medication down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.